It's a delight and a privilege to catch up with Dr. GVS Murthy, Director of the Indian Institute of Public Health today. And Dr. Murthy, your whole life and career, you have straddled between two spheres. One is the whole sphere of data and statistics, and the other is the sphere of policy, especially in the public arena. So, and I was just wondering, how do these two spheres overlap with each other?
That's a very interesting question because it's just like a marriage. Each and every activity for the wedding is timed to perfection. Because at the end of the wedding, you want everybody happy. The couple should be happy, the visitors should be happy, the family should be happy. The same is the case with evidence generation. Why you collecting the evidence is to try and make the best of the best possible situation. So if you have enough data, which you then present for advocacy purposes, talk to the ministers, the program planners, that data then actually makes them change their minds on how an activity is to be undertaken. And we have classic examples of what has happened in India. The first activity that we had in relation to blindness control in India was basically trachoma control. And that was because the Indian Council for Medical Research showed that trachoma was the commonest cause of blindness between 56 to 1962. Later on, there was another survey in 1971 which showed that cataract was an important cause. Nearly half the blindness because of that. And the national program then evolved, making cataract an important component of the program. As time went by, more evidence became available that we were perhaps missing posterior segment causes, missing glaucoma in the way the data was collected. When better data was generated, it then led on to a comprehensive program. We have the National Blindness Survey in Pakistan, which then led to the government of Pakistan committing itself to tremendous support to the blindness control program there. The same in Nigeria, the same in so many low and middle income countries across the globe.
Now, just staying on this whole blindness issue, I understand statistically in India over 100 million people, especially in the rural parts of India, need to deal with this particular issue, and a majority of them probably just with dealing with an uncorrected refractive error problem where a simple pair of glasses might solve what the needs are. But one of the statistics was on how much India as a country loses in productivity, and the numbers were staggering, probably between 26 to 30 billion dollars. Now, is that correct, and how does one actually put a figure to something like that?
Well, loss of productivity, the figure is absolutely right, because loss of productivity is calculated as the minimum wage that a person would have earned if they had the opportunity to earn a full day's living. And if you put the year together, you look at about 300 working days in a year and look at the cost that they would have earned, the wage that they would have earned, and look at the product, then that is the sort of figure that you will end up with. You also need to sometimes add the cost of care of an individual who has visual impairment, which means that another person at home is losing a wage because they need to take care of the person who's visually impaired. So it's not just the person who is himself or herself affected, but the person who needs to take care of them is also losing a wage. So the loss of productivity is dependent not just on the individual, but the sort of family support system and the level of visual impairment that the individual has. You may not get a job that you desire because of poor vision, so that itself is again loss of productivity. And mind you, here when we are looking at productivity, we are basically looking at the minimum wage in the community. You're not looking at the executive salary, and if you put that, then the loss of productivity will be tremendously higher.
I mean, the other one is a bit of a practical question, especially to the people with a bit of a science background who might be listening to you. Now, a country like India, with its complexity, urban, rural, I mean, I would imagine every country in the world has got that, but India probably has that to a higher degree in terms of, the rural, the urban, the language issues, and a whole range of different problems in terms of going and getting, accurate data. So if you're trying to do something in a national level, how do you incorporate these kind of differences so that you get a reasonable, statistical balance to have a national approach to doing things?
Well, there are two ways of doing that. The first way is actually weighting your sample itself. So, like you said, rural urban, we know that about 70% of the population is in the rural areas. So, what you would look at is that as far as your sample is calculated, that 70% of the sample reflects the rural concerns. You also have, like you said, languages. So, let me take the example of a state. The state of Uttar Pradesh or the state of Bihar, which together are 25% of the nation's population. So the sample that you draw out, you are waiting for it in such a fashion that 25% of your sample is drawn from these two states. And when you pool all the data together by taking care of these concerns, then the numbers that you are actually dealing with is reflective of the inconsistencies in the population. So that's at the sampling level. The second thing that you could do is, supposing you've not done this when you've sampled, then during the analysis, you weight your analysis, you weight your data, give adequate weights to rural, urban, residential in Uttar Pradesh or Andhra Pradesh or Telangana, and then arrive at a calculation which is similar to doing it by the sampling method. The first method is definitely more accurate, nearer to the truth, because in the very collection of data, you're making that effort. The bigger the differences in society, the larger that you look at collecting information from the sampling units, the better the data is.
Now, in conclusion, if there's one survey you've done that would probably get people to open their mouths, saying, somebody's done that kind of a survey, what would that be?
Well, I have done 3 different surveys of a similar nature, and all 3 of them which have had far-reaching consequences. One is in relation to blindness in India and in Nigeria, and for the first time one sees that in Nigeria glaucoma is a more leading cause of blindness, and when you look at India, it is cataract which is the leading cause of blindness, which means that if we have to allocate funds both at a national or an international level, this etiology or epidemiology of disease has actually helped to decide how much fund should go to which particular activity, disease control as well as infrastructure support. Another one is in relation to the available human resource services and facilities in India, and that has been the first ever baseline collection of data which we've done across the country. That was an eye-opener. We were able to then look at what is the number of ophthalmologists, support staff, the skills that they have, the gaps that exist, and what the infrastructure needs to do to try and bridge those gaps. So this human resource survey across the country, which I was involved in very closely with the period of 2003 to 2005, was the first ever done in this country on such a massive scale.
Thank you so much for your time, and it's a pleasure catching up with you.
Thank you. Pleasure meeting.